Today is National Cancer Survivors Day that is being celebrated with a walk and 5K this morning in Grant Park. This event is in its 30th year, and with us this morning is Dr. Sheetal Kircher, the medical oncologist, director of the Lurie Cancer Survivorship Institute at Northwestern, and cancer survivor and founder of Luminaries, Hendricks. Good morning, ladies.
Good morning. Good morning.
So this event is happening this morning. I have a feeling you're both going to rush to get over there. But first, Dr. Kircher, let's talk about survivorship. When is a person kind of considered a cancer survivor? At what point?
Survivorship is really any patient who's been diagnosed with a cancer throughout the course of their life. So it includes anyone who's had to endure that time when someone has told them you have cancer, and it takes them throughout their life and all their challenges.
Talk about those challenges, especially after treatment. What do cancer survivors go through? What do they face?
Being diagnosed with cancer it just rocks everyone's world. No matter whether you're still dealing with your cancer or you've completed your therapy, there's physical, social, psychological issues that you'll deal with for the rest of your life.
And you're the director of this Survivorship Institute. What is that, and what do you guys do for patients?
The Survivorship Institute at Northwestern is that union, that necessary union between the highest quality clinical care and research, so we can keep doing better. Our treatments have advanced so much in the last 20, 30 years, but with that comes all the late and long-term effects of our cancer treatments that we need to learn more about so we can help people live a good life for years and years and years after their diagnosis.
And Laura, you are a cancer survivor. Tell us about your experience.
Yes, I am. I was diagnosed 5 years ago. Actually, I was at a pediatrician appointment with my 3 young children, and the pediatrician looked at me and said, "Your coloring looks off," as I was explaining the symptoms of my children, and she recommended I get some blood work done. And that landed my husband and I in an ER 48 hours later, hearing those words, "You have cancer."
Oh my God.
And I had an aggressive form of AML, which is a form of leukemia. And my cancer was extremely aggressive, and I was put in the hospital that day and spent the majority of the next 7 months at Northwestern Practice Hospital receiving the most amazing health care that any cancer patient could hope for.
Wow.
Through multiple rounds of high-dose chemotherapy, full body radiation, and then a life-saving stem cell transplant through cord blood on May 25th of 2018. And truly, we are so lucky in Chicago to have access to amazing healthcare and survivorship care, and we take that for granted because most survivors do not have that type of opportunity. And there's truly in survivorship, especially a health equity problem that we're trying to bridge to allow anyone that goes through this terrible, terrible disease to have access to world-class healthcare.
Not just healthcare, but it sounds like health support, right? It just sounds like you've been supported through all this. Talk about nonprofit Luminaries. What is this?
This is truly to help bridge that gap. My husband and I, who is my rock, my caretaker, we knew how lucky we were in survivorship to have the journey that we are taking. When it became clear that I was close to beating my cancer and was going to have a chance at long-term survival, I truly was very paralyzed about what the next step looked like.
Sure.
And it was very lonely and fearful and confusing. And we knew then that we needed to do something, not only for me, but to try and help other cancer survivors. So we built Luminaries is the first nonprofit to deliver self-care practices around things that are important to cancer survivors, like gratitude and sleep and rest and hydration, to their doorstep. So we deliver a science-backed practice habit building program that helps cancer hospitals and organizations extend their clinical care into this moment of meeting that survivor at home, where they're trying to rebuild in much more of a mind and body individualistic connection.
That's
and so
great.
we've delivered over 1,300 wellness kits to cancer survivors across the United States and Canada just in the last year of existence.
That's great. Congratulations on that. Doctor, we're running out of time, but tell us about the event today. When and where?
Downtown Grant Park. It is, the energy at this place is awesome. We get to walk, as an oncologist, we get to walk side our patients outside of the clinic, outside of the infusion center, and it's such a fun event. to celebrate patients, families, and the people that we've lost.
Can we still participate?
Yes, you can still walk right in and register. So it's beautiful out, and come join us.
Walk right in and keep walking. Ladies, thank you so much. Such an important topic, and thanks for bringing light to it. We appreciate it. Enjoy yourselves this morning. Thanks so much.
Thank
Thanks
you
so much.